demonstrate a video on spontaneous vaginal delivery. Before we start the process, we need to make sure that we sanitize our hand and wear our gloves.
We start with epistomy. Epistomy is done during the contraction when the fetal head is visible at 3 to 4 centimeter of diameter. Then we insert 2 fingers between the perineum and the fetal head and incise the perineum vertically downward or laterally downward away from the rectum. Now we start with the Regent's maneuver. Using a sterile towel gloved hand, we exert a forward moderate pressure on the fetal chin at the tip of the maternal coccyx. Now using another hand, we exert pressure superiority against the occiput. We now apply a moderate pressure on the fetal chin with a posterior hand covered with a sterile towel, and while the suboccipital region of the fetal head is held against the symphysis. We now start with the delivery of the baby. For this, we grasp the fetal head with both our hands and we exert a gentle downward traction until the anterior shoulder appears at the under the pubic arch and brings about its descent. Now exerting upward traction, we deliver the posterior shoulder, and then exerting moderate traction, we deliver the rest of the body. We now support the baby's head with one hand, and then we slide our dominant hand along the back of the baby until its leg and grasp both its ankles, and then we deliver the body. We now place the baby on the maternal abdomen, previously draped in a sterile towel, initiating the EINC protocol. After the delivery of the baby, we now proceed to the delivery of the placenta. At first, we confirm the cessation of the umbilical cord pulsation, and then we proceed to the clamping and cutting of the umbilical cord at 2 cm and 5 cm from the base. We now check the signs for placental separation. At first we see a sudden gush of blood, and then we see the rise in the uterus of maternal abdomen, and then we see the lengthening of the umbilical cord, and also the uterus become globular, which is also known as the Calkin sign. We now conclude our process by checking the vaginal wall for any lacerations, and also we check if the uterus is contracted by placing our hand on the maternal abdomen, and lastly we check the umbilical cord for the presence of the vessels, that is 2 arteries and 1 vein.